Good morning. I'm Brian Lowe, and welcome to the Inspire Ostomy Secrets webinar. This morning, our experts are Lisa Becker and Cricket Henley. Lisa Becker has lived with Crohn's disease since she was 13, and today, over 20 years later, she has turned her adversity into a career passion with a business that helps fellow ostomists feel more confident in everyday life. She founded Ostomy Secrets as a young mother who was not satisfied with the intimate apparel for everyday use that was available to her then as a new ostomist. Ostomy Secrets represents a lifestyle and philosophy focused on freedom, confidence, and inspiration for ostomists. Our second expert is Cricket Henley, who was also diagnosed with Crohn's disease and ulcerative colitis over 25 years ago. Her disease waxed and waned for several years, responding to various medicines, and ultimately she became immune to them. After 4 years of battling illness, Cricket underwent permanent ileostomy surgery after an extensive hospital stay. In the past years, she has experienced all manner of feelings, and she's become a true expert on the topic. Cricket now lives her life on full volume, speaking about many topics about having an ostomy, talking with people about products and services that are available to them, and giving encouragement where encouragement is needed. Inspire is an online patient community, and we encourage everyone to visit ostomy.inspire.com and join the online support community. I'd like now to pass this over to Cricket Henley, who will begin our presentation. Thank you.
Well, thank you, Brian. I can sure say that Lisa and I are super excited to be here today to present to the Inspire community. We want to thank Convatec and Inspire for allowing us this privilege. As an overview today of this presentation, we're going to use the metaphor of building a puzzle in relationship to our lives as people with ostomies. With that idea, I want to give you a quick outline of the presentation so you know what to expect for the next 45 minutes. After we each share our personal stories along with how Ostomy Secrets got started, we'll jump into this concept of puzzle pieces as a strategy for managing your ostomy. So buckle up, we have a lot to cover. You might be wondering, how did this puzzle concept get developed? Well, honestly, I was thinking about it once when my family and I were doing a jigsaw puzzle. As we were once building a jigsaw puzzle, I started thinking about how much of what we do in trying to form the puzzle picture was exactly what we do as persons with ostomies when we are trying to figure everything out. While building a puzzle, we Henleys each have our own strategy. After we dump everything out on the table, we turn that big, messy pile over so each puzzle piece is face up. We then separate the border pieces as we start to fit the border pieces together. And then as we build, we have our own ways of going about trying to form the whole picture. My husband, he loves to match the shapes, while my daughter likes matching colors. I like to use the picture on the box, while my son seems to always be the one who finds the pieces that no one else can find. We like to call him our eagle eye. Well, in relating this to having an ostomy, everyone goes about their journey in a slightly different way. Well, I think we would all agree that we're trying to build the best picture that we can. So we each have a strategy to manage our ostomy, and as a community, it's always wonderful and encouraging to hear what others are doing. So Lisa, to start, I'm going to ask you to share your personal story as we start to build this puzzle with our Inspire community.
Thanks, Cricket. Good morning, everyone, or good afternoon. I just want to thank everyone for dialing in today. This is exciting, and I hope that you take away lots of good tidbits and can fill in the pieces to your puzzle. That's the final goal. So for those of you who maybe haven't been on ostomysecrets.com, I am the founder of Ostomy Secrets, and my story was I was diagnosed with Crohn's disease at the age of 15. So I had Crohn's full flare for about 15 years before I ended up undergoing ostomy surgery. So for that 15 years, that consisted of a lot of pain. People who are familiar with Crohn's disease know that it's a very debilitating disease. There's lots of just pain and medicine, and it really affects your life on all aspects. So for me, I ended up getting into the hospital and getting very ill after the birth of my daughter. She was 1 year old when I had the surgery, and although I remember the morning I woke up, I felt instant relief in a way because I immediately was awakened to the fact that I wasn't running to the bathroom 30 and 40 times a day. But I also woke up with a sense of complete feeling just lost and very puzzled, so to speak, on how I was going to continue this next phase of my life. So there was a lot of mixed feelings that I had and just pure fear of what to do next. And I know that people on the phone, those of you who are nursing professionals, you see this in your patients. Those of you who have had ostomy surgery, I think every one of us has felt that. And those of you that maybe are contemplating ostomy surgery, it's the unknown can be scary. And I never was an ostomate before, so this was the first time I had to kind of move forward and go ahead. And I ended up taking it day by day, and I'm fine today. I've had my ostomy surgery for it's been 8 years now. I was also really blessed to be a part of a program called the Great Comebacks. That's a program that's sponsored by Convatec, and I was lucky enough to be recognized as one of the winners in 2008. And because of that program, I was exposed to a lot of amazing people who underwent ostomy surgery as well, who lived very productive, very happy, healthy lives that were truly a positive blessing to me to get to know. And then obviously, between being part of the Great Comebacks program and just after my own personal journey, I also felt that the main issue for me after ostomy surgery had to do with lifestyle. I did not know how to really get from the hospital, getting home from the hospital, and then entering my life. There were some lifestyle issues that I really struggled with. Just getting dressed, for example, that was a big deal for me. Putting on my old clothes again, just feeling comfortable out in a public place. And so for me, Ostomy Secrets was about creating products that would help me with my lifestyle. And so they really started, the company started based on my personal need, and we develop undergarments and bathing suits and some other wraps and other products that help you live life after surgery. So what started as just my personal need, I thought, well, if I feel this way, there has to be other people that feel this way. And Cricket, if you could go to the next slide, please. So I started the company, and I thought I would add some humor, some realistic humor. I had all of my inventory, my first batch of inventory delivered to my garage. So I guess they say most companies start out that way, but this was very humble beginnings because I really didn't know where this was going. And I remember my husband saying, just help one person, and this is going to be deemed a success. So we didn't park in my garage for several years because that was the center where we packed everything up into envelopes and mailed them out. But what I realized was when I was first on the phone with people who were calling, the most amazing thing happened. Once customers knew that I, in fact, walked in their shoes and I, too, had an ostomy, there was this amazing relationship that developed. They started asking questions that I didn't always know the answers to, but that I could relate with. And I think that really is the secret behind Ostomy Secrets, not only providing solutions to lifestyle issues that I personally had, but also a connection, and that's why we're all on this phone call today. We're all wanting to connect as a community and help each other, and I hope that Cricket and I could do that for you all today. And then I put in a funny picture of my very first conference. I went there with samples. It was a WOCN conference about an hour from where I lived at the time, and WOCN, for those of you who are not familiar with it, means Wound, Ostomy, and Continence Nurse, and those are those little angels in the hospital that usually help us after surgery basically learn how to take care of ourselves and move on. And I know it's a bit scary. I'm standing next to that mannequin, but we started from very humble beginnings, and now I've been fortunate enough where we partnershiped with Convatec several years ago, and 2 years ago they in fact bought Ostomy Secrets. And my intention was, once it became really, I realized there was a need that these products were fulfilling for people all around the country. I wanted it to get out to more people, and that's where Convatec came in. Convatec now is being able to, take the role and the goal of Ostomy Secrets and really spread it worldwide. So now that Convatec owns Ostomy Secrets, we have access to doing things like today, the webinar series, to be able to help more and more people. And then I'd like to pass it on to Cricket, who will further explain her story and kind of where our paths have crossed.
Absolutely. So unlike Lisa, I was not sick with Crohn's growing up, but I was struck with it in my mid-20s. I'd been married about 4 years, and at about 25 years old, I started having Crohn's colitis issues. I tried not to succumb to the disease. I tried to pursue an active lifestyle. As Brian said in the intro, my disease really waxed and waned, and for 4 years, it was up and down, up and down. When it was up, I felt great. When it was down, I felt horrible. I got pregnant with my daughter, Chelsea, who is 21 now, and 6 months after she was born, the disease returned, and it was very angry. It reared its ugly head with a vengeance. I spent 6 weeks in the hospital, and after those 6 weeks, then I ended up with permanent ileostomy surgery. In fact, I just had my 20-year anniversary of having my stoma, and as I look back, the 20 years have been so much better because I'm not sick anymore, and even though my illness was just a short 4 years, it was pretty intense. So it was kind of wild. I ended up meeting Lisa, and I want to just tell you the quick story about it because I just think it was such an amazing thing the way it happened. I had never spoken about my ileostomy or my disease or anything publicly. I wasn't ashamed. I wasn't embarrassed. I just had no reason to talk about it. I had a great support group in my husband, who I'm almost been married to for almost 30 years. My family was wonderful. My children accepted it. Everybody was great. But a friend of mine, she asked me if I would speak publicly to a group of women about how I had gone through this situation. And thinking about it, it kind of scared me. But I thought maybe if I could help somebody, kind of like Lisa was saying with the underwear, I thought if I could help somebody just in general about how to get over a hard situation, I would do that. So I spoke to this group, and in that audience was a girl who was a friend of Lisa's. And afterwards she came up to me and said, oh my goodness, I know a girl who's just gone through the same thing you went through all those years ago. Would you be willing to talk to her? Of course I would. So I called Lisa up and invited her over. She came over. The funny part about it is we found out we lived about 1.5 miles apart from each other, which was just really neat. She came over. She walked in the house, and I said to her immediately, I'll show you mine if you show me yours. So there in the kitchen of my house, I lifted up my shirt. She lifted up hers. We pulled the top of our pants down, and we looked at our ostomies at each other, and we laughed. We were like, that's it? That's all it looks like? Wow, that's not that big of a deal. And so what was really, really cool is that instantly we just formed this great bond. I mean, from that moment, I remember it like it was yesterday, and it was over 6 or so years ago. And so that was just a really neat thing how we were brought together. So from that, we ended up really becoming great friends. And Lisa started talking to me, and I'm going to have her share in a minute about how that was. And then she started talking to me about Ostomy Secrets and stuff. So Lisa, I'm going to give that back to you, and you can kind of talk about how we took our puzzle pieces, yours and mine, and we joined them together.
Yeah, I still remember the day like it was yesterday, Cricket, because I remember I was several months out after ostomy surgery, and for those of you who are on the phone, and for those of you who have ostomies, if you remember those few months after surgery, you're still kind of accepting it and wondering, you're trying to put everything together. Well, imagine I am in that stage, and I'm still kind of in the drama phase because a lot of emotions are very, you go through a lot of traumatic things in the hospital when you get home. And I remember just being so happy I was alive because of how sick you are usually after ostomy surgery or before ostomy surgery. So I was just happy to be alive. And I remember meeting Cricket and thinking, oh my gosh, she's cute. She looks healthy. She's had this for 13 years. So I know that I'm at least going to live 13 years. And I remember staring at her and thinking, how is she able to wear such fitted jeans? How is she able to be so comfortable? Those seemed kind of low on her. At the time, I was wearing very kind of blousy pants that were, stretchy and comfortable. And typically those weren't the pants that I chose to wear all the time. And so I remember just looking at her thinking, oh my gosh, and I just had all these questions for her about diet, about, how many times did she change her pouch? All these questions started coming out. And I needed her to help me fill those pieces of my puzzle because I was so early in my journey. So I think I pretty much attacked her with a bunch of questions. And, Cricket being Cricket was just an amazing mentor, and that started and still is. She still is a mentor to me on so many different levels, this relationship and friendship that we have. But I did mention to her, I was asking her, well, how do you do this and how do you wear this? And she was looking at me like I was crazy. Well, why can't you just wear jeans? And I was like, well, isn't it uncomfortable? And I have this idea, and I want to make this particular underwear so it becomes easier, so you don't feel the bag, so you don't feel the weight of it on your skin. And she just kind of looked at me like I was crazy. And I thought, okay, well, maybe I'm the only person that has this problem. So she said, okay, well, I'm going to support you. I think your intention is good, and I'm just, any help you need, I'll be willing to give you any advice. And I said, okay, well, I want to make you a sample, and I want you to try it on. And I knew by her mannerisms, I thought, oh, she thinks I'm crazy. But I just want her to try a pair. And so the funniest part of our story is the story that Cricket will now tell you about the first time she tried a pair of underwear.
Well, it is true. It's funny, like we said, Lisa, you think about those things in your life where you can picture yourself in that exact moment. I remember sitting at your dining room table and you saying you were going to do this. And do you remember me? I said, underwear, schmunderwear. I'm like, I don't need any more underwear. I finally had gotten to a point where I was fine with my underwear, which sounds like a funny thing to say. But what I realize as I look back now, I thought I was fine, but with my underwear that wasn't ostomy underwear, it was regular underwear that I thought worked for me. And I could wear jeans and stuff, and that was great. What happened, though, was I was making adjustments to keep my pouch completely empty at all times so that I could wear the clothes I wanted to wear. So now instead of being in the bathroom from being sick with Crohn's, I was in the bathroom every 15 to 30 minutes, still all day long emptying my pouch. And so those little changes of not being sick but still having to manage it added up to big changes, and I realized I spent still so much of my time in the bathroom. So you gave me that pair, and I said, okay, I'll wear them. I went away for a weekend. I wore them, and I fell in love with them, and I didn't have to empty because that pocket gave me the support from my pouch that I really needed. So if you remember, I came back and I told you, I'm like, oh my gosh, you've got something here. I am in. This is amazing. And from there, it just kind of turned into this crazy thing that I started helping you write the newsletter, and we did the Cricket's Corner thing, and then it was just kind of this one thing after another, and people started ordering underwear, and it got crazy, and you and I were running to the post office every day, and it was out of control. Do you remember that? We didn't know what to do, and so remember I said, hey, we need help. We need help. So what did we do with that?
Oh, this is the best part. This is what Ostomy Secrets is about. We talk about how you and I have related so well, and so we realized, well, this is bigger than us. And so we were able to recruit and kind of build a team of people just like us. We have now a team that works on the Ostomy Secrets hotline, and they are all people that have undergone ostomy surgery, and they actually all have permanent ostomies. They come from all different backgrounds. Their job is to serve people like us, to answer the phones, a lot of questions that usually end up in suggesting a product that Ostomy Secrets may provide, but it's really connecting with people that live the life they also live. And so it's this relationship of knowing what the other person has gone through. Cricket had mentioned that she was amazed that this underwear had helped her, but it really comes down to the fact that everyone wants to feel normal, and normal is what you know pre-surgery. And Cricket, her normal had changed, right? So she was wearing dresses that had pockets in them because she was holding the bag because it was moving around, or she would wear certain pants or certain clothes. And we found that we built our team, and they all had similar stories. And ironically, we met them because they were coming to Ostomy Secrets for products and were so affected by the positive outlook and positive outcome of our products in their lives that they wanted to be a part of something special. So because of that magic I experienced the first few weeks on the phone of people calling, we really felt that we encourage others to call our line and to talk to people that walk in those shoes. And everybody has a positive attitude and lives a full, healthy life after surgery. And I think that's the best thing. The next slide, if we can move on to that. It's about life after surgery. It's about moving on after you're given this surgery and this ostomy appliance and figuring out what to do, putting your pieces together and making your puzzle. And that could be really, really scary. You don't know where to start. And I think that today what we'd like to do is give you and I'll have Cricket further talk about this, the border pieces. Get the most important pieces to your puzzle, and then you add in the other pieces. So Cricket, I'll have you take the next slide about people developing their own border pieces, and what we feel are really the stepping stones to launching into a healthy, happy life after surgery.
Absolutely. And just thinking as I'm looking at this picture before we move on, I remember feeling, and I'm sure that this resonates with everyone, if you have an ileostomy, a colostomy, or a urostomy, it does not matter where you're at with that ostomy, but after surgery it's like a million pieces have been dumped over on that dining room table, and it's just in this big pile. And it's a really, making a puzzle at home isn't scary. Life after surgery can be really scary because there's no direction. There's no instruction manual. And so unless we start turning those pieces over one by one, if you're just fresh out of surgery, it's a lot harder than it is 20 years later. So as we move forward with the presentation, we just want to talk about your border pieces. We want to talk about how as you turn those things over and one by one each piece is put together. So we've talked about our story, and I hope that you guys appreciate where we're coming from with that. And I think that what's so important, just Ostomy 101, that there's a management of the pouch, there's accessories, there's odor control, there's all these kind of things. And Lisa, you and I have talked so much about this, but you really, at the beginning, you had some issues with some of these things of how you were going to manage these things. So why don't you share with the audience what were some of your biggest issues with just that first border piece? What did you do?
So I would say, always starting off on a positive, I was lucky enough to be put into an ostomy appliance system that worked. Okay, and I've thus learned that a lot of people don't have that experience. So that was a huge positive that I experienced initially. So once I learned, now the learning part of it, everyone has to, going into ostomy surgery, you just have to be patient with yourself, and it takes time. It takes time to know that you have a stoma on your stomach now. It takes time to get used to that. It takes time to learn the steps of how to put an appliance on, and that was the biggest struggle for me. I was very overwhelmed. I had paste, and I had scissors, and I had all these things, and I remember it taking 30 or more minutes the first time just to change, and obviously, that's not the case. As time goes on, you get used to things. You decide things you need. I do need paste, or I don't need paste, or I need adhesive remover, or I don't need adhesive remover. Over time, it becomes part of your routine. And I'm happy to say today, after 8 years, when I change my pouch, I do it really in less than a minute. And I don't think about it because it's second nature to me. And I want to encourage those people on the line who maybe are fresh out of ostomy surgery, be patient with yourself. It will, in time, it will become second nature to you. But selecting the right pouch is very important. So like I said, I was lucky in getting into a pouch that worked well. I didn't leak. If anyone on this line is leaking or you're having issues with your system, please do not accept that. Education is the best thing you could do for yourself. Educate, educate. Call the manufacturer's 1-800 number. Call your nurse. If there's an outpatient clinic at your hospital, go. Do not settle for something that is not enough. You deserve a pouching system that works and works well, and you deserve to know how to do it, number one. Once you get past that, and we all know that we have to have an ostomy appliance on our stomachs, cover our stomas in order to leave the house, right? So that's the most important piece as far as I'm concerned. The other pieces like odor control. That was a big deal for me. I had little ones at the time. I now have 2 children, and especially now even, 8 years post-op, my son is 3.5 years old, and he thinks the topic of flatulence is hysterical. Okay, every 3-year-old does. So mommy can't necessarily control the sounds all the time. So that is an issue, and obviously you have odor, and he thinks just anything to do with the bathroom is funny, and so he'll make comments about, oh, mommy, did you go poo-poo in the potty? This is a part of life, and so I do like to use other appliances or other services and products that are able to minimize that smell. So for example, I use a product that you put 1 or 2 drops in the toilet bowl before emptying your bag, and it negates the smell. And I like to use things like sprays or wipes to help take my bag off. These are appliances or accessories for your appliance that will help you deal with little issues around putting an actual ostomy system on you. And I know odor control, we all know that's a big deal. Staying in a hotel room for the first time, I remember that was a really big deal with a bunch of my girlfriends. And so I was able to take some pills instead of just doing the drops in the toilet. There is pills that you can ingest that actually negate smell too, and they help you manage that. So that's a big deal, especially if you're going back to work again, you're emptying in a public restroom, maybe you're going out to dinner, and maybe you're going out to dinner at someone's house. These are real-life issues that we'd like to address with you and hope that some of these solutions may help. Our website actually offers some of these lifestyle accessories. There are these these little sachets called diamonds that you could put into your ostomy pouch that help control odor. And Cricket, you have some great kind of 101 ideas regarding odor too. I believe peppermint oil is a big tool for you, right?
Yeah, I love it, and it's funny. It's just it's an essential oil that you can get either at a local health food store, Whole Foods, whatever, Trader Joe's, and it's under $10. And I carry it in my purse, and I keep some in my restroom. I put a couple drops in the toilet bowl, maybe a couple drops in the actual wastebasket, and it just makes this beautiful smell in the restroom. So if you have an ileostomy or colostomy, that's a great thing to kind of counteract that. I've actually been in public restrooms where I've been in the stall with my peppermint oil, and it smells so good, and people come in and go, oh, golly, this bathroom smells so nice. And I'm thinking, if you only knew what I'm trying to cover up in here. So that's been really neat too. And like you said, the diamond sachets, those are great. And in that line of the sachets, I love the spray. There's an adhesive releaser spray. I've had skin issues for the good part of my 20 years with my ileostomy, and that spray has been something that I will, if I have 1 penny left in my life, that will be something that I will always purchase because it just helps your wafer peel off. So I would encourage everyone to look at the SensiCare line on our website too. Moving forward from once you get your ostomy appliance in the right situation, the right spot, you're not having leaks. Like Lisa said, don't put up with leaks. Now you got to think about food. And before, when we were so sick, food was such an issue of diet and what you can and can't eat. And then as you have your ostomy and you're getting back into life, pretty much it's kind of like, wow, I can maybe eat a lot of stuff. But I know for me, when I left the hospital, they left me with a little red book that was bound together at Kinko's, and they said, this is what you can eat, this is what you can't eat. Well, honestly, guys, I did not believe it. I thought, you know what, my diseased colon is gone. I can eat anything I want. So I ate a lot of the things that were off limits on that list, and honestly, I ended up with some really, really bad and dangerous blockages, which really, in many ways, even hurt more than it did when I was sick with Crohn's, because the belly just was killing me. And if you've had a blockage, you know what I'm talking about. So I realized, and Lisa, you and I have talked about this so many times, chew, 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 chew your food. We tell our children that all the time. We have to live by that advice as well, right? And I pretty much chew, to this day, every single bite of food 30 to 35 times. I've just gotten into a habit of counting my chewing bites, and that has really helped. Staying hydrated, drinking water all day long, drinking coconut water, That's been another thing, so that I can eat now 20 years later a lot of different food that I couldn't eat then. But if I do these things, I have a much better chance of digesting it. I always tell people about food enzymes, and that's another thing you can get from a health food store for under 25 bucks, say, a full spectrum enzyme that's going to help you break down your food. As we age and as we get body parts removed, our enzymes are fewer inside the intestinal tract, and so that's been one thing. And that's, if you have a question about that too, that's something we can answer later. And then juicing, I can't eat a lot of super raw stuff, but I can juice stuff, and that's really helped me with my digestion and being able to get a lot of really good nutrition. Some people have a harder time with that. Lisa will tell you about that, that's a little bit more difficult for her. I think the bottom line for eating is you have to find what works for your body, stick with it, and if you do, you're going to be okay with the digestion aspect if you have an ostomy that is a stool output one. So Lisa, what do you want to add to that?
I would say the most important thing I learned, I wish someone told me this, is after surgery, there's a lot of scarring that happens inside, and things like strictures and all these words I never heard of before. And your body's basically trying after surgery just to kind of settle back with the parts that are missing. Trying to find if you have an ileostomy, for example, with me, I don't have a large intestine, so it took time for my small intestine to start acting like a large intestine and absorb water. Hydration is a huge, huge issue. I remember my doctor kept saying, drink lots of Gatorade. I'm not a big Gatorade fan, and all that sugar didn't do well for me. So, for me, coconut water was a huge, huge help. But also when you're dealing with scarring issues and strictures, you have to be careful about what you eat. So I would say the best advice I could give you is when you get home after ostomy surgery, eat soft, healthy, warm foods. I'll never forget, right after surgery, I was kind of starting to feel better, and I was smiling, like, oh, I'm not running to the bathroom anymore. And I said to my surgeon, well, what's your advice with, what I could eat? What do you think I could eat? And he said, Lisa, go home and eat whatever you want. And I thought, well, okay. So about 4 weeks post-op, I did just that. I had grilled pork chops and grilled asparagus, right? I mean, that's kind of a healthy thing to eat. Not so much. The asparagus, the strings in the asparagus caused me to have a massive blockage, and within 12 hours, I was in the emergency room with an NG tube up my nose, and I was in a lot of pain. I was vomiting, and for those of you who have ever experienced a blockage, it's really not fun. So it wasn't good advice to just go home and eat anything. And so that's why I really would like for everyone to heed the advice of be careful with what you choose to eat. Eat slow, chew, obviously. With little ones, I don't always have the luxury of chewing my food really well. I'm usually sticking my hand in someone else's mouth, feeding someone, or running around and chasing the others. So on those days, I'll eat soup because I know that I'm safe with it, that the vegetables in it are cooked well, and it's not going to cause a problem. And then over time, I would say, after I started to figure out the foods that worked well, I thought I could never eat nuts again. Well, now I eat nuts, but you know that I am chewing those nuts pretty good. And when it comes to juicing, I don't really have the time to juice as much because my kids are still young, but I do drink juice in general. I try overall with specifically my situation with Crohn's disease, eating a lot of raw food sometimes impacts me in a negative way. So eating a lot of cooked food for me is the best way for me to feel my best. So that's just some advice in terms of food. I think, like Cricket said, take it slow, try things, be careful, and eventually you'll be able to eat and know the food that works for you and makes you feel good. A lot of people come to the table after ostomy surgery for very different reasons. Sometimes it's IBS issues, sometimes it's cancers, and so there's not really a rule to say you absolutely can't have this. But I would say the biggest thing to worry about is raw foods just because the fiber factor, right? Once we have intestines removed, we don't need as much fiber as we did before. So be careful about that fiber, soluble versus insoluble, and those strings from the asparagus, for example, that's insoluble, and that might cause blockages. And blockages are a big issue for people who have ostomies, and hydration plays a role in that. So you want to make sure you're hydrated. Also for your ostomies out there, hydration I know is a big issue. So we talked about, the appliance, getting that situated. We've talked about food. So now we've addressed the issues. So you got two border pieces. We've addressed the issues of now you can get out of the house because you're going to have an appliance on. You could go out and eat, maybe meet a friend for lunch, right? But we want you to shower. We want you to get dressed. We want you to feel good about yourself. And we want you to make that first public appearance and getting out of the house the most comfortable one. For me, showering and bathing was a little bit scary because I had a wound. I had my incision opened up. And so for me, I was very concerned about getting it wet. I was that person that put saran wrap on their stomach because I thought that I couldn't get anything wet. And that is not the case. Ostomy appliances are meant to get wet. They are made to withstand going in pools, taking showers, and you should absolutely positively enjoy a shower, take a bath, and not be concerned about your appliance. And I reiterate, if your appliance is in any way compromised after taking a bath or a shower, that means you do not have the right appliance for you and your situation. It should not come off. It should not leak. So, get out. Take a shower, feel good about yourself. And I know Cricket has a really funny story, which I agree with, about taking that first shower without an appliance on. I mean, it's Commando, right, Cricket?
Yeah, we joke about going commando. Well, when you have an ostomy, you go stamando when you get in the shower or the bath without your appliance on. It's liberating. It's the best day of the week. And, the first time you do that's really scary because what if your stoma is active? You know what? I was like, so what? I'm in the shower. I can completely wash it down. But I also make sure that the mornings that I take a shower, I've gotten to the point now where I can plan it. At first it was hard because I had leaks and there were times that I had blowouts and it was just any time of the day. But I've gotten to the point now, like I said, where I can plan that, and I don't eat late into the evening so that I know that I'm empty by the morning. I also, if for some reason I have to change it in the morning when I did have to eat later in the evening, I eat a couple marshmallows before I change my, before I go stamando in the shower and change my appliance. Just a couple marshmallows, 15 to 20 minutes. It slows your output down, but it will not give you a blockage. So if you have a colostomy or an ileostomy, the marshmallow trick is phenomenal. On our website, we have newsletters that have tips, and that's on there too, so we can give you that information for archives. I like to set up my changing station on my bed. It's kind of funny. A lot of people are like, oh, you have like your shrine on your bed. No, I've always done it that way. I've always kind of laid down halfway, sit up halfway, and that's just my way to do it, and I like everything on the bed. But like Lisa said earlier, I can change my pouch in 2 seconds. I mean, that's an exaggeration, of course, but under 5 minutes where I do everything from top to bottom. It's second nature. I don't think about it. Many people I know like to change theirs as soon as they get out of the shower, and they do it right there. Lisa, I remember you telling me when your kids were little and when Anna was little and you were very fresh, you had to change everything in the bathroom right there, get your clothes on. You didn't want anyone to see it, and how that was your routine. And now you've kind of loosened up on that a little bit.
Absolutely. I think, well, I didn't want, there was multiple things. I wasn't okay with, I hadn't yet fully been comfortable with the fact that I had, when you take your appliance off, you're staring at a red stoma. It's a lot at first. You're like up close and personal. And so I had to slowly accept that. I just had to get used to it. And I felt with toddlers running around and my husband in the background, I just wanted to be okay with it first. And so I would go in the bathroom with all my clothes, take a shower, change, get fully dressed, and I would come out of the bathroom fully dressed. And I never really did that before ostomy surgery, and now I don't do it. Currently I don't do that. But it was one of those things that I just needed some quiet. I was nervous about doing it, and eventually now, I change it with my kids around, and I get all kinds of questions because we talk openly in my household about that. That's what happens when you have young kids. They just stare and want to know, and they ask all these questions. And now that I'm okay with it, they're okay with it because I am able to pass on a very positive message because I'm comfortable with, putting my appliance on. I'm not shaking like I used to shake those first couple weeks. And I think a changing station, by the way, is a great idea. Even to this day, I wear a two-piece system and I throw a wafer out and a bag out. Also, I'd like to mention regarding changing stations. My changing station 6 years ago, 8 years ago, is very different than my changing station now. And that is because I became very educated about different ostomy appliances. So, years ago, they had clips, for example, and I was in a clip system, and I used paste, and I cut. Well, now there's a system, I use Convatec, and there's a system called Moldable, and I don't need the scissors, and I don't need the paste. So my changing station is actually much more simpler, and that's basically just because I was lucky enough to come across some new products, and I gave them a try. So that's something I'd like to encourage all of you to do regarding the changing station aspect. Is your changing station may change, your routine may change, and most likely it will, and hopefully it gets for the better. And I think that as long as you're comfortable with like we mentioned, putting on your appliance, taking a shower, going out to eat. The next big stage, obviously, after you get out of the shower is getting dressed, right? So the things I wore pre-surgery are quite different than the things I wore post-surgery. Let me explain that. Pre-surgery, I clearly didn't have a lot of issues. I didn't have a stoma to cover, and I was, I kind of wore fitted clothes. I was sick a lot, though, so those were those issues. I had to get to the bathroom really quick and do what I needed to do. Post-surgery, I was worried. I had my belly was distended, which I think most of our bellies are very sore after we have ostomy surgery. So I didn't want to wear anything that was restrictive at first. Like I said, I had a wound issue. I had scarring. I had stitches. So I remember those first couple weeks, I actually put my maternity clothes on. Now, this did not a lot of good from a vanity perspective and my overall confidence, but it made sense because they were stretchy, it was comfortable, it didn't restrict my stomach, and the stoma size typically after surgery is larger than it will be. It's swollen, and over time it starts to get slightly smaller. So those first couple weeks, months, I wore a lot of loose-fitted clothing, and then, fast forward to today, now I think I push it just because I can. I wear, dresses that I think are form-fitting, and jeans, any jeans, and I don't have to really be thinking too much about clothing and comfort because now I know what works for me. But in those first, couple, months, I really kept it basic and easy, where I felt confident and secure, and I felt there wasn't a lot of restrictions. Obviously, having Ostomy Secrets products dramatically changed how I dressed because I felt more confident. I felt that the bag was secured in a pocket close to my body, and that people couldn't see it under my clothes, and I felt that it was just like an insurance policy. So, Cricket, I know that you have some great advice about getting dressed and some clothing options.
Well, I remember that a really smart nurse said to me, remember, you don't have a red neon sign blinking that says I have a stoma, which is why we put that on that slide, because often when we go out, do you remember that feeling like you thought, oh my gosh, everyone is going to know I have a stoma, like I have a stoma with arrows pointing at it. And once that was said to me, and once I got that picture and everything that you just said, I did all those things, it was not that big of a deal. And so as I navigated public places, as I went back into work situations or social situations, I just had to figure it out, and I had to realize I'm okay. I can empty in a public restroom. Where is the nearest restroom? Having been a Crohn's patient, I knew where all the restrooms were. So now it was different though, and I just had to figure out how to empty my pouch into a public toilet, or if I was at someone's house or whatever, having supplies on hand. There were many times, I'm embarrassed to say, that I was somewhere where my bag did have a leak or something burst and I didn't have supplies. And so I always tell everybody, man, take supplies. Don't leave them in your car for 6 months at a time because it's going to melt, but take some with you so that you have them just in case. So, there's a lot of really kind of, essential, like we said, Ostomy 101, things that are going to build your border. Once you get these border pieces built, then you are going to feel like you have the confidence now to start the inner pieces, now to start the rest of your life. But if you don't get these border pieces built, you're just going to feel like it's that mess of puzzle pieces on the table. We were talking about community and support, and Lisa, I want you to talk about this because there's been so many things out there that have changed from the 20 years for me and even the 13 for you, that people can really reach out and go to.
Yeah, I think that, for example, this forum today, what I would have given to be able to dial in and to listen just for these tips. Not everybody is blessed with a nurse that has the time to tell us these, or just we're using language that maybe other people aren't used to using who don't live with ostomy, living with an ostomy, and dealing with the odor issues and putting on an appliance. I remember when I had my first leak and the nurse kind of looked at me like, oh, that's going to happen. And I just thought that was okay. It's not okay, and we're here to tell you it's not okay. So it's about, at this point, living life. You are now healthy. Hopefully, the people on the phone today, if you have had ostomy surgery, for whatever reason you ended up, I hope that you're all healthy and whatever disease you came to the operating table with is gone, or I hope that you're in a better position now than you were pre-surgery. And it's about getting you out and living your best life. And these organizations of community and support can help you do that. So we mentioned the Inspire community, who's hosting this wonderful webinar for us. Obviously, I had mentioned Ostomy Secrets and the peer-to-peer support that we provide on the phone, and also just to be able to talk to someone one-on-one. The UOAA, there's various support groups all around the country of people that get together and are able to talk openly with each other. And the opposite of that is when you call the Ostomy Secrets line, it's one-on-one. I know after my surgery I wasn't ready to go to a support group, so I really would have given my left arm to be able to call a number just to ask someone a few questions. But now I enjoy those support groups. I go to them quite often. I speak at them, both Cricket and I do, and we really find it so amazing to connect with people of different ages, different surgeries, and I learn stuff every day from people. And also, huge resource, and obviously has come to us even more so in our Ostomy Secrets community, is when Convatec purchased Ostomy Secrets, we now have access to help our customers get the best products. And so, we're not medical experts, so if you're going to call Ostomy Secrets and we determine that maybe you're leaking a lot, we can't give you that medical advice, but we sure can pass you on to the Convatec hotline. And on that hotline, there are trained ostomy nurses that can help you, and they can send you samples to try different products. Maybe the product you're in isn't working well with your skin or your particular situation. They can talk to that. So I hope that when you do call the 1-800 number of Ostomy Secrets, we have the resources to really put you in all different directions. And it's really a gift today. I want to thank everybody on this phone line who's dialed in. It's been such a gift to have your time and to have your attention. And I do hope that when you hang up today, you have gone on with at least one tip you didn't know, and to make this time that you gave us worthwhile today. So I truly thank you for that. And Cricket, I know that we have a lot to cover in the next one if you want to cover that.
I do. Thanks, Lisa. This time went really quick. It's like she said, I really do hope. It has always been our intention to be here to help people. We really, really care, and we are all in this together. So we hope that our experience could help you, and then you could pay that forward with someone else. We know a lot of you are already doing that. We see the posts on Inspire we see the camaraderie that's being built there. So we look forward to having our second session of our Ostomy puzzle pieces that we want to unlock those pieces. We've built our border now. The next session is going to be, what does life look like after these pieces have been built? And so we will be sending out an email soon to give you information about when we will be offering that next webinar, and we really, really hope that you'll sign up for that. To thank you all today and give you a special offer, we want to give you 30% off an entire order at Ostomy Secrets.
Woohoo! Everyone loves the deal.
And I laugh because when she first started the company, before I was a part of it, she actually sold me my first couple pairs of underwear and only gave me 20% off. So I still hold that against her, even though she's one of my customers. So we're offering y'all 30% off an entire order, which is unprecedented. And there's a code for you that you could go at checkout online, ostomysecrets.com, with an expiration of April 12th. And plus, for those of you who joined us today, who attended this webinar, we also want to offer you a free Ostomy Secrets Classic Wrap because we believe so much in our American-made products. We just love what we have, and we want you to fall in love with them as well. If you want to take advantage of that offer, you can email Heather at ostomysecrets.com, and she can help you work through that. So we just want to thank you for today. We know your time is really, really precious, and we just really, really thank you. If you have any questions, we'd love for you to email us at info@ostomysecrets.com, and we would like to incorporate those questions into our next presentation, as well as answer them personally and privately if that's what is necessary. So we're going to close right now. I just want to thank once again Inspire. I want to thank Convatec. I want to thank our Ostomy Secrets team, who we know you will be connecting with. And we just encourage you to check out all those different websites and encourage you to look forward to the next webinar. Have a fabulous day. I hope that it's getting warm where you live and that you are just going to get out and enjoy your life as you move forward in your journey. So we're going to close now, and we just thank you very much.
Yay! Good job.
That was